Thanks all for joining. We'll go ahead and get started shortly. It looks like folks are still joining, so I'm going to kick us off in maybe a minute or so. Good afternoon, everyone. Welcome to the school's spring webinar. We are going to go ahead and get started. Can I get a thumbs up that you can see my slides? Yes, perfect. Thank you all. Thanks for all for being here. We have a full agenda today. We're going to start with welcome from our executive director and medical director. We'll have a communicable disease update, immunizations update. We'll hear about the revised school regulations, child fatality review overview, and then there will be an option at the end to answer or to ask any questions you may have. Just a brief reminder to keep yourself on mute unless you are asking a question. Please feel free to put your questions in the chat, and we'll have time for Q&A after. So we'll be sending the slides out as well as the recording after this webinar. So feel free to share with colleagues and friends. Without further ado, I'd love to turn it over to Jennifer Ludwig and Dr. Chris Urbina.
Thank you, Laura, and good afternoon. And thank you all for joining. We really do appreciate your participation and joining us for the spring webinar. Of course, everything that we do in public health could not be achieved without your partnerships. So we appreciate everything that you do every single day to care for the young people in our community. And we truly do value everything, as you'll hear today with the measles update, our child fatality, our school program. All of our programs really rely on your partnership and our relationship with you. So I just want to say thank you and welcome you, and hope that this is helpful and useful information, and that you know who you can call on when you have questions or there's something that you are dealing with. And before I turn it over to Dr. Urbina, I just want to give my appreciation to him and thank him for his years of service with Arapahoe County Public Health. Some of you may have heard, but Dr. Urbina is going to be retiring this summer, and we are searching right now for a chief medical officer. So in the fall, we will probably be introducing you to a new chief medical officer for Arapahoe County Public Health. But Dr. Urbina has been integral in the development of Arapahoe County Public Health. We're in our third year, and we wouldn't have been able to do this without him. So I just want to thank him for everything that he's done for us and for our community over the many, many years, and wish him all the well, and look forward to continuing on, hopefully a little bit beyond his retirement. So Dr. Urbina.
Shucks, Jennifer. Thanks very much. I just wanted to extend my thanks and appreciation to all the school team that we worked diligently with over the last several years. And I've said this before and I've said it again. You guys really are my heroes in terms of the support that you provide, not only to the communities, but to our broad school communities as well. So again, thanks very much. And I look forward to hearing more about the seminars. And of course, we'll be available for more questions. Thank you.
Maddie, over to you. Thanks,
Okay.
Jennifer and Chris.
Thanks, Laura. Hi, everyone. My name is Maddie Hostetler. I am one of the communicable disease epidemiologists here at Arapahoe County Public Health. I'm excited to be speaking with you today to go over different reminders and updates from our program. If you have any questions, please put them in the chat, and myself or someone else from our team will answer them in the chat or live, depending on time and things like that. Next slide. Okay, perfect. So like I always like to do whenever we have these webinars, I like to provide a brief overview of our program and what we do. So the Communicable Disease Epidemiology Program investigates reports and outbreaks of infectious diseases to reduce the spread of illness within the community and provide resources on disease control. Certain diseases that have public health consequences must be reported to public health to keep illness from spreading. These are called reportable conditions. We are always ready and willing to work with you and your schools. We love to hear from you. We might reach out and contact you for a few different reasons. Some examples of that would be when we receive reports of communicable diseases to go over our exclusion recommendations, ask for help with contact tracing, and to provide notification letters. Well, we will also contact you if we have reason to believe an outbreak may be going on at school.
And so you already had lunch, then you just get to go hang out for lunch and recess?
I think someone's talking. I'm gonna mute them. Okay, there we go. Where was I? Okay. So we will also ask that you contact us to report or ask any questions about communicable diseases. There are no silly questions, and again, we love to hear from you. We ask that you reach out to us about outbreaks. All outbreaks are immediately reportable in Colorado, meaning that as soon as you suspect that there could be an outbreak going on at your school, you should let us know. And outbreak definitions do vary by illness, just meaning by timing and number of cases or suspected cases within that time period. So reach out to us if you have any suspicion at all. So if you notice an increase in a type of illness at your school, please reach out. Next, wildlife. We wanted to provide a reminder that you should please contact us with your wildlife questions and possible exposures. So this includes for birds and maybe some possible concerns about avian influenza. And then we're getting into our busy rabies season. So reach out about any questions or concerns or possible exposures for rabies reservoir species, which in Colorado, that's bats, foxes, skunks, and raccoons. Thank you. I mentioned reportable conditions earlier, so I wanted to call out that the state has created. Oh, so I just want to make sure no one had a question. I wanted to mention that the state has created a separate list of diseases and conditions that are required to be reported by laboratories versus by providers, facilities, veterinarians, and additional reporters. Additional reporters meaning you and us, your school staff. That's school nurses and staff. And if this is nothing new, it's just a cleaned up document. The link is here and it's in the slide. So when they get sent out, you can link to it there. And it'd be really great if you could just have them printed out and have it in your health office as a great reminder. Perfect, thank you. We would also like to after hours emergency contacts for all schools in the county as best we can. This is so we know who we can reach out to in an emergency that affects your school. So you might have already been contacted by your school's designated epidemiologist and given our team's after hours phone number, the new reportable conditions poster that I just showed the link to, and also a request for an emergency contact from you. So if you've already provided us with this information, thank you so much. If not, no worries. Just please do that as soon as possible. And I want to say it would be rare that we would reach out after hours, but if we're made aware of a case of illness that could affect the health and safety of your school community, so things like meningococcal disease or measles, we want to be able to notify you promptly and work with you as soon as possible. So if you do not have a designated contact, please think about who that may be. And after you identify one, let us know, or if you know right off the top of your head, I know this person would be great. Please email us at comudis@arapahoegov.com. Thank you very much for that. Okay, measles. I'm going to switch gears to discuss measles. So far this year in 2026, there have been 16 cases of measles in Colorado. In 2025, so for all of last year, there were 36, and a little bit different to last year. Some of the cases this year have impacted schools and their communities. So we want your continued collaboration so that all together, oops, I almost knocked over my water bottle. That would have been bad. But all together, we can be as prepared as possible. Next slide, please. So please call us right away if you hear of someone in your community having measles or suspect that someone does. At the end of my little section of this presentation, I'll have our phone number and email listed. If you suspect someone has measles, we will want to know the person's demographics. So where they live, what their name is, their date of birth, a good phone number, what their symptoms are, if you know what their vaccination status is, if you know of any known recent travel, whether it's within the United States or international travel, and then any known exposure. So maybe if this person says, I was here on this day, and they're able to share that with you, that would be helpful to us. But if you don't have some of this information, no worries. We're able to just take what we can from you and get started to follow up. And as a reminder, measles is a highly contagious and acute viral disease caused by the measles virus. It typically presents with symptoms that we call a prodrome, that are present for a few days before a rash begins. And that prodrome typically includes a high fever or some sort of fever, and then either all or some of what we call the 3 C's of measles. So cough, conjunctivitis, which is red watery eyes, and or coryza, which is runny nose. And then after that period of time, a rash develops. It's a maculopapular rash with flat and raised skin lesions. It starts on the face or around the hairline and then spreads down to the rest of the body and extremities. Whenever we talk to people, we like to describe the rash as spreading like a bucket of measles. So picture someone taking a bucket of the measles rash and then pouring it at the top of someone's head, and then it's spreading down that way, and it also disappears the same way it came on. The incubation period of measles, so the time it takes for someone to be exposed to then develop symptoms, is usually 8 to 14 days, but has a range of 7 to 21 days, 21 days being the maximum amount of time typically that we would see or consider on the public health side of things. So next slide, please. So next I'm going to go over this measles school recommendation flowchart that was created by CDPHE, and then used during a recent measles outbreak that involved a school. I know the text is quite small, so we can all do our best to try and look at it and read it. And again, the slides will be sent out. And we had CDPHE's permission to share this with you, just so you guys can kind of get a good picture of what things could possibly look like if there are cases or an outbreak of measles at your school. So again, it's subject to change for different situations, but could be used if there's cases in the school or an outbreak. And this is for students and staff, so to be used with students and staff. And I'm going to stay on this slide for a little bit, so you can kind of look over things as I'm talking. And so while you're reviewing it, I'm going to read the definitions of exclusion and quarantine, because CDPHE received feedback from when this was used, or when there was a response involving schools earlier this year, that things could get a little bit confusing there. So I want to take some time now to make sure we can all be on the same page. And again, if you have questions, please let us know. So exclusion, we use the word exclusion in a lot of different circumstances, whether we're talking to somebody to your schools about things like pertussis, which is whooping cough, or maybe a younger child with Shigella or Shiga toxin producing E. coli. For exclusion for measles, that means staying home from school. This requires the person, whether it's a student or a staff member, to not come to school or any related activities starting 7 days after the initial exposure to measles through 21 days after the last known case was present in the school while infectious, or through 21 days after their last exposure to a measles case, whichever is later. And then quarantine, that is something that would be implemented by public health for people who were exposed to measles and they might develop an infection because they are susceptible. And people who are under quarantine are required to remain at home, starting 7 days after their initial exposure through 21 days from their last exposure to a measles case. So that being said, I'm going to use this flow chart to go over an example. So let's say a student was in school while a person with measles attended school. They do not have proof of immunity. And the reason why in this situation for this student was because MMR or MMRV vaccine had been declined in the past, so they're not vaccinated. We would recommend that the student receive MMR post-exposure prophylaxis. So that'd be 1 dose of the vaccine within 72 hours of their initial exposure to the person who attended school with measles. If they do not receive MMR post-exposure prophylaxis, if they do receive, I want to make sure I'm being clear, and do not misspeak. So if they do receive MMR post-exposure prophylaxis, they will not be excluded from school and will not be quarantined. We will just work with them and ask that they let us know if over the next 21 days they develop any symptoms of measles. And if this person, on the other side of things, if this person who was at school and attended while someone with measles was infectious, and they do not receive MMR post-exposure prophylaxis in time within that 72-hour period, they would be excluded from school and all school activities starting 7 days after their first exposure, and this individual would be placed under quarantine. The current recommendation based on this flow chart, again, things are subject to change, would be that this person still does get an MMR vaccine. And if they receive a dose during their exclusion or their quarantine, they can return to school 21 days after their last exposure. So that was a lot, but again, the slides will be sent out and we love to have any questions. Next slide, please, Laura. Okay, perfect. Please encourage your staff to locate their measles vaccination records. If it wasn't obvious by looking at that flow chart, proof of immunity is very important to everyone involved in a response whenever there's a case of measles or an outbreak of measles involving a school. It can usually be pretty easy for us and other people in public health to find a student's vaccine records, like in the Colorado Immunizations Information System, or SIS. But it's a lot of times like what we've run into or what feedback we've heard from other LPHAs in the metro area. It can be a lot more difficult for staff to find their records. This is because not everyone is in SIS, or maybe they grew up out of state. I grew up out of state. I'm from Kansas. So a few years ago, I had to call my pediatrician and I asked for my records to be sent over to me just so I could have them. And then I was able to get them to SIS, which is great. So I think somebody from immunizations maybe will mention this later, but if maybe somebody's from out of state, they find their records, just contact us, let us know, and we can maybe hopefully be able to work with them to get them into SIS so everything's in one place. So please please encourage your staff to locate their measles vaccination records, because if we do not have proof of immunity for staff or students with known exposure to measles, they will be excluded from school and placed under quarantine until they're able to produce records or if they're able to get post-exposure prophylaxis. Next slide, please. And then that's all for me today. I don't think I took up all my time, which is good. So we have extra time for questions just in case. So if you need to contact our program, you can email us at the email listed on the slide. And then we're also available 24/7, 365 at the phone number listed. All you have to do is call us and leave a voicemail, and someone will get back to you. And thank you very much. Really appreciate your time.
Thanks, Maddie. Feel free to take yourself off mute or put questions in the chat if you have any. I have not been monitoring the chat very well. AI assistance.
I have a question.
Please.
This is Tom Terrell from the Byers School District. So I don't know if it's PTSD or just a panic attack or whatever it is, but when you start talking about staff having to find measles vaccination records, and if they can't find it, they got to take 21 days off. My first question is, who's covering their wages when they're off? Or is there somebody covering? I know what the answer is, and old people like myself, it's like, my pediatrician's dead. How do I find that stuff? I mean, I'm trying to figure out what to tell my people that, also grew up in Kansas. Me. Anything?
Becca, you want to take that? I saw your hand up.
Yeah, thank you. My name is Becca. I'm from the immunization program. I'm actually going to cover a little bit the best way to find your records if you're an adult, to see if you can find those. Another option is that you can get a blood test that will test if you have immunity to measles, mumps, and rubella, because it is common that adults don't have their records. When I was a child, my pediatrician didn't have the CIS records, so those records can be hard to find. So at the end of our immunization presentation, I'll have a few more tips about how to find records as well.
All right, sounds good. I appreciate the person who said ask my mom too. Thanks for that.
Great question.
That is one of the tips.
Any other questions? Whoops. Let's turn it over to Tracy and Becca.
Hi, my name is Tracy Stevenson. I am the community outreach nurse for Arapahoe County Immunizations. So we will be talking about our program and giving a few updates. And like Becca just said, talking about trying to find your MMR records as an adult, which is no easy task. So feel free to put any questions in the chat, and myself or someone on my team will answer those. So our immunization program provides low to no cost vaccines for children and adults without insurance or those covered by Medicaid or CHP Plus. We have 2 locations. Our east location is off of Colfax and Chambers. Our west location is currently on Broadway and Bellevue, but we will be moving to off of Prince Street, just a few blocks west in the fall. Our Aurora location is open for vaccines Tuesday, Thursday, and Fridays, and our Englewood location is open on Wednesdays. And additionally, we have our Shots for Tots and Teen Clinic the second Saturday of every month. We open appointments for these clinics about 2 weeks before they occur, and they do fill up rather quickly. So feel free to send families, give them the number to call and schedule appointments for this clinic. It's a great resource, and we usually have a lot of people show up, so we're happy to serve the community this way. Oh, sorry, go back. Thanks. One thing our staff is really great at, and we love helping schools in this way, is we are very good at international record transcription. So if you have any of those records for your students, please send them to our email, right here, immunizations@arapahoegov.com. We are happy to assist with those. We have lots of nurses who will do those and send them back to you. Also, if you are interested in having us come to do a mobile clinic at your school, that's also the email to use. Myself or one of my coworkers will reply to those emails. And in general, appointments for our clinic are easier to get in the spring and summer. We get very busy in the fall and winter. So the best time to send students to us is now until school starts. If you have any families that need some updates to their immunizations and such. Also, one thing we forgot to put on this slide is we are now offering titer services. So like Becca just stated, you can get a titer to see if you have immunity to MMR or varicella. So this is a great resource if you've lost your shot record, you've moved many times, but you know that you got the vaccine. So that's a great option. We do offer those as well. And to call to make an appointment, we have our phone number here. So when you send the slides out, that'll be available. So one thing that is really one thing for the schools is the Colorado Board of Health requires most schools and licensed daycare centers report their immunization and exemption data to CDPHE annually. The window for reporting is October 1st and it closes January 15th. So we have included the reporting website on this page. So this includes all public, private, and the parish schools that are grades K through 12, as well as childcare centers, preschool, and Head Start programs that have 10 or more students in them. And so this data gets submitted and gets put together. And we have also included this website on the top bullet, where you can see immunization rates for the various schools. And this is also data we use for the county to decide which schools we should reach out to or which schools would really benefit from having a clinic at the school. Some recent updates, so updates to Tdap immunization requirements. We just wanted to touch on this. Tdap is now required for 7th grade entry as opposed to 6th grade as it was previously required. So before the student's first day of 7th grade, routine Tdap in general is recommended for 11 to 12. So this new recommendation kind of aligns better with the age group for 7th graders. MMR vaccines for school-age children, so older children and adolescents who were not vaccinated according to the 1-year, 4-year-old schedule, do need 2 doses of the vaccine to be considered fully protected, and these doses are separated by at least 28 days. So we do have lots of MMR at our clinic, and we're happy to serve children for those appointments. And now I'm going to turn it over to Becca to talk about MMR and adults.
MMR in adults, so already came up. Thank you for transitioning to this section. So it is important that adults are protected as well from MMR. Up to date for adults is one vaccine, one MMR vaccine, unless they're a member of the special population. And special populations are students at post-high school, secondary education institutions, all healthcare personnel, close contacts of immunocompromised people, people with HIV infection who are not severely immunosuppressed, international travelers, and groups identified by public health at increased risk of measles during an outbreak. Also, if they have presumptive evidence of immunity to MMR, which that's what that positive lab titer means. If you've had a positive titer, that also counts as protection. And next slide, please, Laura. So evidence is having a documented dose of the MMR vaccine, or 2 if you're in the special populations, or having documentation of that lab test, or if you were born before 1957. So prior to 1957, measles, there was so much measles going around. You are presumed immune because measles was so prevalent at that time. This is even cautious in the US because we began routine measles vaccination before most other countries. So I want to emphasize this is important for staff in your school. This is a good time of year to really encourage people to find their evidence of immunity, either to find their records or to look into getting titers, because everyone wants all the adults protected. No one wants anyone out of work for 21 days. Next slide, please. And here's some tips on how to find your immunization records. So this is a history you may have had as an infant, child, or adult, and might have been required for other school, job, travel purposes. It can be tricky to find them as adults. These are some places you want to check. So you can check with your current or previous healthcare provider or public health clinic that if you remember who you visited in the past. Those also might only be maintained for a limited number of years. Ask your parents or your caregivers if they have your childhood records, and look through your home or your parents' home. Look through old papers, baby books, school or camp forms. Y'all, my parents just moved and my mom's like, look at your polio record.
Oh, gosh.
My mom handed me my paper polio record. Check with your school, university, or college health service if you've been engaged with any of those institutions recently, but especially medical providers or schools may only keep records for a short period of time. And you can also ask previous employers if they might have them. And then a few more tips on the next slide. So you're going to get these slides after this meeting. This first QR code helps you to access if your Colorado immunization records are in the system, you can access them on your own here. This is a QR code that links to other state immunization registries. So if you were seen in other states and there's a chance that those might be in those databases, you can also find that information here. And there's all different ways to request records because that's different by state. And if you've been in the military, so this is a QR code to check if you have any vaccines from time served in the military. If you can't find your records, options are to go ahead and get a lab titer where they'll check your blood to see if you have immunity for measles, mumps, rubella. We do have the option of offering that service here at Arapahoe County, regardless of insurance. You are welcome to get a lab titer pulled to check for immunity. It's also offered at other labs. If you have no record of that MMR vaccine, it should be covered and is safe to receive again if needed. So that's another option for any of the adults you know or staff you know that they could go get that vaccine at any time from a provider. If they're uninsured or underinsured, they're welcome to reach out to us as well. And I see there was a question in the chat from Tom about communicable disease.
Yes, thanks, Becca. My name is Melissa Orozco. I'm our Communicable Disease Epidemiology Program Manager. I put it in the chat, but Tom had a great question of, confirming whether someone had exposure to measles and their recommendation to stay out of school or out of work. And so we're just always recommending that if you hear of someone in your school that, believes they were exposed to measles, to reach out to our team so we can work with them directly on, what type of exposure they had. We do have varying degrees of exposure versus someone who is exposed in a house or in the school or just potentially passing through a grocery store, and then their own vaccine status and what our recommendations will be. If someone is recommended to be on quarantine and stay home for 21 days, that will always come from public health. So we just encourage you to reach out to us and we will work with that individual directly.
I see that Lorraine has a question too about attending a technical college and being required to provide documentation of 2 MMRs. I'm not sure. I think so. It may be 1 MMR if it's an adult, but that may be in that post-secondary category. So Lorraine, let me put my email, or what technical school too, and I can follow up with you. And I'll put some things in the chat. Laura, I'll hand it over because that'll take me a sec, but I'm hoping to have an
Okay,
answer quick.
perfect. Thank you, Becca. Thanks all. If you have any other questions, feel free to put them in the chat.
Laura, you're muted.
Thank you, Becca. Thank you. If you have any additional questions, please feel free to put them in our the chat, and our staff will try our best to answer them. I'm going to turn it over to our environmental health team. Courtney and Danny, take it away.
Thank you, Laura. So I'm Courtney Tomlin, and I'm here with Danielle Henderson, and we're with the Environmental Health program, and we're the School and Early Childhood and Schools program, and we conduct the school inspections in Arapahoe County Public Health. Next slide, please. Sorry, one more slide. Thank you. So I just wanted to briefly introduce, we started doing regulatory inspections at Arapahoe County Public Health back in September of 2025. And to date, we have conducted around 50 inspections in our high schools and middle schools within Arapahoe County. That is, we still have quite a bit of our inventory still to get through. We do inspect high schools and middle schools more frequently than we do elementary schools. So just because you haven't seen us doesn't mean we're not coming. We will see all of our schools, but we'll go through our inventory as we have different inspection frequencies depending on the different curriculum offered in different schools. I have put the link to those regulations where you can find what rules do apply to schools within the state of Colorado. It's one set of regulations for the entire state, as well as the Arapahoe County Schools website where you can find those regulations as well as some checklists and some other resources as well. Next slide, please. So the point or the main topic that we wanted to talk about today was that our regulations that we use when we conduct those regulatory inspections within schools has been updated. So back in February of this year, the Board of Health the State Board of Health adopted a revised set of regulations for schools, and those regulations go into effect August 1st of this year. And the next few slides, I'm just going to talk about some basic changes that we're seeing. The State Health Department has kind of divided them into 3 different categories of changes that remove burden or duplication, changes for clarity, and then new requirements, just for those reasons, just to understand kind of where different things come from in terms of those revisions. And just an important part to clarify is that until August 1st of this year, our current regulations are still in effect and would still be applied. So first, I'm just going to talk about, these are very wordy slides, and these are a slide deck from the State Health Department that they put together. They also have a presentation that you can watch that delves deeper into a lot of these different categories. I'm just going to briefly touch the surface of some of the ones that are more impactful or just some just kind of helpful points. So changes that remove burden. One of the things that the state has trying to be consistent on is temperatures at hand washing sinks. So originally the hand sink washing temperature was 90. They lowered that to 85, and that's kind of across the board. If it's a child care center, a restaurant, a school, the minimum hand sink washing temperature is 85 degrees, just for consistency among the state. And then the other thing that I highlighted on this slide as well is we do have certain areas that we have a lot more regulation that applies to within how we do our inspections. And a lot of our regulations focus a lot on the vocational side of things, where there's science, some wood shop, woodworking, metalworking, things like that. And chemistry and science is the one that we see that has the most. And the last line on this slide is just talking about how some of the things that in terms of chemicals that were restricted, it was a burden for some of our schools to have certain restrictions around some of these chemicals that are less volatile or less concerning. And so those have been removed from a restricted chemicals list, which I can delve in deeper as needed, or you can follow up on the slides for the State Health Department. One of the things that has also changed as those in those effective needs classes or in individualized therapy, frequencies around cleaning and sanitizing equipment has they've taken the restrictions up back a little bit, and instead of sanitizing equipment after each student has used it, it's now at the end of the day in those specific spaces. And one of the biggest areas of burden that we saw in terms of science and different chemicals within different areas of the schools is around time frames for restricted chemicals. And there's a whole list of restricted chemicals, so I won't get too far into the weeds with that one because that's very specialized within our regulations. Next slide, please. A lot of, I wouldn't say a lot, but there's a significant amount that they took out of our regulations because there was a lot of duplication. Certain things regarding building code, electrical code, other things that are already regulated by a different authority or organization were in our regulations, and they just didn't need to be there because it was a duplication, as well as like emergency shutoff. Those are maintained by different, sorry, one more slide, Laura. Sorry, we're regulated by a different set of standards, a set of regulations, and then as well as the all hazards plan that was regulated by a different department as well. Once again, there was a specific requirement on asbestos management plan that's also regulated by a different department at the state level. This I wanted to caveat that this is no longer within our school regulations, but it is something that's regulated by a different entity. So just because we don't necessarily look at an asbestos management plan, you may get, as a school, some information or some regulatory oversight from the Air Quality Control Division or the Water Quality Control Division, or a different set of regulators, but that's just no longer in our regulations, as well as things like the certificate for the boiler. Next slide, please. And then just wanted to highlight as well that there are some putting more specific parameters around how the time frame around correction of certain items. We know that not all items are going to be easily corrected, especially if they have a monetary component or a fiscal budget concern, or as well as staffing concerns. But just wanted to highlight that there are some specificity now placed in our regulations around when things can be corrected. Before it was just a reasonable time. Now there are some specific parameters around those correction timeframes. Next slide, please. This, once again, some of the new requirements are around carbon monoxide. We do have a lot of schools that have carbon monoxide detectors tied into a fire suppression system, but just making sure we know if an alert happens, what is the protocol, who's responding, what is kind of the plan or protocol in place for the response if a carbon monoxide alarm does go off. In addition, there is a new requirement around having a plan to address extreme indoor temperatures within schools, whether they're getting too hot or too cold. There is a template on the state website where you can kind of format your policies for that template. And we'll provide the links for that website and those resources at the end. Next slide, please. Once again, if you have a culinary program in your school, they added some new requirements around some of the curriculum that happens in those classes, making sure we're serving safe food. There's hygienic practices around hand washing, washing dishes, storage of food, things like that. So culinary and those programs have a little bit more regulations to them, as well as if we have a science program, what we run into is we have a lot of preserved specimens that we don't know how long those specimens have been in the school. They might have been kind of a hand-me-down specimen, and really just kind of looking into what preservatives are those specimens in, and if we need those in the school, and if it's not a prohibited chemical like formaldehyde. Next slide, please. The biggest thing that the state really wanted to work through in terms of schools is chemical procurement. So how are we obtaining chemicals? Are we obtaining what we need in the volumes and the quantities that we need? And are we disposing of them in proper time frames? Just because certain chemicals do have certain time frames, that you either need to use it or dispose of it. Otherwise, it either becomes safe or it's not effective anymore. You'll see on the bottom left side of the slide that there's some checklists that the state has created around ordering chemicals, a chemical hygiene plan, and some templates to kind of really reiterate the importance of not ordering a lot of chemicals in bulk and really ordering just what you need for your curriculum for that school year. Next slide, please. There is another requirement as well that activating the eye washes that are required in certain spaces depending on the chemicals that are used, making sure that those are activated monthly. We check them that they're maintained and tested once a year, but just activating them once a week because there is a significant amount of buildup that we see that happens within those showers. The water is brown when it comes out. It's probably not a best practice to use when somebody's trying to rinse their eyes in the case of a chemical spill. And then also within those vocational science classrooms, adding a little bit more requirements to a first aid kit. The previous regulation just stated they had it to be adequately supplied. Now it's putting some specific requirements into what needs to be in those first aid kits in those classrooms. Next slide, please. So here are the links of the unofficial version of the updated regulations, the summary of the changes, and then a deeper dive into some of the slides that I talked about today, as well as you can look at those slides as well on your own, and then some other resources that the State Health Department has created, and they're still working on creating more. On the right side is just their purchasing checklist that you can utilize as a school when you're going through and purchasing chemicals for the school year. And that's it for me. Thank you so much.
Thank you so much, Courtney. What questions do you all have? All right, we are going to turn it over to Rebecca to tell us a little bit about the child fatality prevention system.
Thanks, Laura. Hi, everyone. My name is Rebecca Rapport-Verdejo. I'm a public health nurse here at the health department, and I've been helping to coordinate our child fatality prevention system review team for about 3 years. You can go to the next slide, Laura. I wanted to just share a couple data points and resources from the child fatality prevention system. We spend time communicating with schools, gathering records and information, and so that could potentially trickle down to you. And I also want to acknowledge that we really couldn't do this work without our school partners. So wanted to thank you for all that you do and sort of share some data and resources back with you. So the child fatality prevention system is a statewide legislatively mandated program that began in 1989. At the time, it started as a statewide review of all deaths that were considered to be preventable. So anything that's a homicide, suicide, accident, or undetermined cause of death as ruled by the county coroner. We look at those deaths to identify trends, develop prevention strategies, and help to potentially reduce fatalities of children across the state. There are, I think, about 45 local teams across Colorado that do child fatality prevention review. So this is a separate process from Human Services Child Fatality Review that looks at fatalities, near fatalities, and egregious harms. Our goal is really to look upstream and see what prevention strategies could we implement to prevent future deaths. So the Arapahoe County team officially began in January 2023. Previously, the Child Fatality Prevention System in Arapahoe County was hosted by Tri-County Health Department. We can go to the next slide, I think, Laura. So as I mentioned, the purpose of the reviews is to talk about why a death occurred and prevent future deaths. We gather records from the coroner, Department of Human Services, law enforcement, schools, and other hospitals and other partners to get a holistic picture of what a child's life and circumstances looked like leading up to their death. Those recommendations gets shared to the Arapahoe County Public Health website, which I will put a link to in the chat in just a minute, and also into a statewide legislative report that goes to our state capitol every single year, written by the State Health Department. So that's how the information gets used. And then again, we hope that partners who participate in review meetings get to share information and help implement prevention strategies. I wanted to share, Laura, can you go back one really quickly? Sorry. This slide shows the leading manner of death. So again, accident, suicide, homicide, or undetermined cause for school-age children. So we looked at 5 to 17 years old. This is looking at data from the last 5 years. And you can see here that accidents and suicides are leading causes of death for this age group. Now you can go to the next one. Thank you so much. So how can your school get involved in fatality prevention? On the left side of the screen, you'll see the leading causes of death, again, for that 5 to 17 age group over the last 5 years. This is looking at 82 deaths in that time period. The leading cause of death is firearm. So that can be either a homicide, a suicide, or an accidental death caused by a firearm. Closely followed by deaths due to motor vehicle. And then we've got asphyxia. That's typically a suicide, but not always. And then a accidental poisoning, like an overdose death or suicide. So that's looking at these different causes of death, which I think is more where we can see actionable prevention strategies. So on this slide that you'll get a copy of, I've listed a couple links for ways that you can get involved in preventing fatalities. First is to review the recommendations that our multidisciplinary group comes up with every month when we meet and review fatalities. So that's the best way to say what is recommended to help prevent future deaths. You also can reach out to us for a supply of cable gun locks if you'd like to distribute those at your school. And I'll put a link to our firearm injury prevention webpage that Laura developed to share more information about that. And we can help connect you to Colorado Ceasefire, which has a evidence-based school curriculum for teaching kids about secure, safe use of a firearm. You can also, in terms of preventing motor vehicle fatalities, we're happy to connect you with Choose Safe, which is a school-based peer-led driver education program, Teens in the Driver's Seat, or with the Arapahoe County Sheriff's Office, who does presentations on road safety. And thinking about suicide, there are opportunities at the state level and then at the local level to get involved in suicide prevention work. And then please always just reach out to public health if you need a resource, if you need help obtaining funding, if you're thinking about data. We do trainings or can help you find the right training. So convening action teams or work groups, and then public information. So please just reach out to us. I've got my contact information down there. I want to thank the districts who are involved in fatality review. We've got Eric Zimmerman from CCSD, Dina Jocelyn Custer and Dan Gerzik from APS, and Brandon Wright. I'm sorry, her name should be on here as well. And then Nate Thompson and Meredith Henry from Littleton Public Schools. We are missing representation from a few of our districts in Arapahoe County. So if you're representing one of those districts today, feel free to reach out if you would like to get involved or you know the right person to get involved. We can really only take like 2 representatives per district. So it's not an open invitation, but these are the folks to connect with. And if you don't know them, I'm happy to connect you with them if you're from one of these districts. So if you have any questions, you can reach out to me. I'll put my contact in the chat. And I think, Laura, we're ready for questions.
Thank you so much, Rebecca. Please feel free to take yourself off of mute or put any questions you may have in the chat. I'm not able to see the chat for some reason, so if one of my colleagues can help me out here, that would be great.
Laura, right now the chats are just me.
Okay, now I can see the
thank
chat. Thank you. Thank you all for joining. We'll wait a minute or two. Appreciate all of our presenters and those of you who were able to join us this afternoon.
Laura, I'll mention that I did answer Lorraine's question in the chat and that only colleges and universities in the state of Colorado who have dorms are required to report. So Pickens is not required to report their immunization data.
Great. Thank you for checking into that and letting us know. Any other questions? Again, thank you so much for joining. We will hold another webinar sometime in the fall, so be on the lookout. In the meantime, feel free to reach out to any of our staff. They are happy to answer questions. I will be sending out the recording along with the slides by the end of the day tomorrow. So please be on the lookout for that. Thank you all. Bye-bye.